During this video, you will learn what a port is, what a port is used for, and some details about how ports are inserted. What is a port? A port is an implantable device that is placed completely under the skin. It provides direct entry to a major blood vessel. Having a port can greatly reduce the number of times you will be stuck for blood draws or IV infusions. The device has two parts: a small round disc called a port or reservoir, and a soft plastic tube called a catheter, which connects the port to a vein. A port can be used for drawing blood, receiving blood transfusions, receiving IV medications including chemotherapy, receiving IV fluids and nutrition, or receiving IV contrast during imaging studies. The port is inserted as an outpatient procedure in the interventional radiology department. Local anesthesia and moderate sedation are used for the procedure. This means you will be drowsy but arousable. You will not be completely out. The goal of the sedation is to make you comfortable during the procedure. Occasionally, patients will have a port inserted while in the operating room for another procedure.
So I want to go through today with you what a port is. Have you ever experienced what this is?
No, doctor.
Okay. So a port goes into your veins so that we can administer drugs, we can do blood draws, all that kind of stuff, and you don't have to get stuck anymore. What we do is we take a port that looks like this, all right? We put this into your chest right here, and it goes up over your clavicle and down into the vein right here. Okay, that's how it's going to sit after we're all done, except of course it's going to be underneath your skin, all right? What we do is we get you on the table, we give you some numbing medication here and here. Now, of course, we do this after giving you some moderate sedation through the IV that we're going to start. That makes you sleepy. You're not totally asleep. You're not totally out of it. You're kind of dreaming. Okay, does that make sense?
Yes, sir.
So then numbing medication here, and of course you're all cleaned off. We go into the vein right here and put a wire down. And then we leave that wire in place, and I use x-ray to confirm where it goes. And then I make a small incision right here. I make a little pocket for this part of the port. I put the port in, tunnel it underneath the skin, up over the wire and down into the vein. We sew you up and then you're all done. Whole procedure usually takes about 15 minutes. After you're done, you'll recover here with us for about an hour. Our nurses will go over education with you about dressing maintenance, about going to swimming pools, onto the beach, all that kind of thing we'll address when you're done. Okay? So possible complications include a risk of bleeding. Anytime you put a needle anywhere in the body, there's a risk of bleeding. That risk is probably about 1 in 10,000. Either way, we go into superficial veins, so I don't anticipate it to be a problem. The only other complication is a risk of infection. Anytime you put a foreign body into the body, there's a risk of infection. That risk is also less than 1 in 10,000, but you should know that even if you get an infection in your toe, that infection could go to the port because it's a foreign body, and that could result in us taking out the port. If we do have to take out the port, it's no big deal. That's how we treat the infection. We take these ports out when you're done with them anyway, and we can always put in a new one if we need to. Any questions?
You will receive sedation during the procedure, so you will not be able to drive yourself home. For your safety, you must have a caregiver available for up to 24 hours after you have received sedation. We hope this video has answered important questions that you may have had regarding ports. If you would like more information regarding a port, please speak with your doctor or nurse.